Hello, Esther. Thursday is World Mental Health Day, and we want to bring your attention to the often overlooked link between HIV/AIDS and mental health struggles, including the alarming rates of suicide in African countries. And joining me now is Brian Ahimbiswe, the Global Youth Ambassador with the Elizabeth Glaser Pediatric AIDS Foundation. Brian is HIV positive and part of the first generation of young people who went on to live with HIV and not die from it. Today, however, he finds that many of those young people who have lived with the virus all their lives are dealing with social stigma, struggling to find love and to find jobs. Hello, Brian. Thank you so much for joining us.
Hello, Jackson.
How are you doing today?
I'm doing well. It's a pleasure.
So talk to me about some of the mental and emotional challenges faced by young people living with HIV/AIDS in Uganda and parts of Africa.
Young people growing up with HIV face several mental health challenges, including but not limited to suicide, which is the most common, rejection, self-doubt, and not being able to cope up with the communities within they live in, but also school dropout. I mean, I was in and out of school because of the mental challenges that I faced growing up amidst all the support that I had from the area psychosocial support clubs. So I imagine how much more the other young people growing up without this much support have to go through.
Absolutely. Why do you think this connection between HIV/AIDS and mental health is often overlooked or not even discussed at all?
You know, the HIV care and treatment programs in Africa are primarily about clinical treatment outcomes, and more often we do not give attention to the psychosocial support and mental health lens. And this predominantly is what we live in. I mean, I only have a few minutes or hours at the clinic, but back home I have all the time to myself. And this is when the reality of mental health draws in, and I'm wondering, should I take this medication? Should I not? How long will I take it? The community around me is stigmatizing me. I have self-stigma within myself. And so why it's not something that has been given priority, and why it needs to be, is that in that time is when I actually decide on whether to continue with this treatment or not. And in a way, it contributes to even the better treatment outcomes that the clinical arm intends to address.
What are some of the misconceptions or harmful stereotypes about living with HIV that contribute to this stigma?
Oh, I could spend the whole day talking about them, but one, stereotypes like you gonna live to a certain age, and beyond that age you will die.
There's a ceiling on how long you live.
Yes, on how long you live. The most common is you won't have a family. I mean, I'm married, I have children and I'm married to HIV negative partner. My daughter is HIV negative, and I'm imagining why all these stereotypes like the medicine, the antiretroviral therapy that we take is toxic or damages a part of our body system, or like so many challenges that attribute to this.
Why do you think these stereotypes still exist up to now? I mean, it's been over 30 years or 40 years since HIV/AIDS was discovered in Uganda. And I remember in the early days, the stigma obviously was one of the major issues that was stopping people from even interacting with people living with HIV/AIDS. Why has it been so persistent?
From a personal experience, growing up in the system and now being able to implement some of these programs, the one thing that stands out for me is treatment literacy. Like the communities, the world within the HIV treatment programs is aware of this, but the world within the outside community still is in the blankets of information gaps. There's still a lot of community sensitization that's needed to let people know that the world has evolved, especially the world of HIV, with innovation and better treatment outcomes, like maintaining your viral load undetectable, being able not to transmit it, which is one of the things that I found the best, alongside mental health and psychosocial support, and many others. So the biggest contribution to this for me is the treatment literacy. To imagine, and because it has evolved, the world imagines that everyone is aware of these HIV treatment innovations that have come up, but it's not. And so sensitization and getting the communities within or outside the HIV programs get to know of this would address it.
Creating more awareness.
Yeah, sure.
Brian, thank you so much for sharing your inspirational story. Thank you so much for joining us here today on Africa 54.
Thank you too, Jackson. That
was Brian Ahimbiswe, a young man from Uganda living with HIV/AIDS, telling us about his story and the connection between HIV/AIDS and suicidal ideation.